COVID-19 has rocked the world of healthcare, but more than just your health and mind, it's impacted our hospitals and how they deliver our healthcare. What has that impact been, and what does it mean for you and your family as you continue to seek healthcare and your own wellness? Joining us today, Andy Carter, the CEO and president of the Hospital and Healthsystem Association of Pennsylvania, to address those questions and more. That's all coming up right here, right now. I'm Sam Chen, and this is Face the Issues. Good evening and welcome to Face the Issues. I'm Sam Chen. COVID-19 has rocked the world of healthcare. That's no secret. But has that impact reached beyond just the virus? How has the pandemic impacted our hospitals? How has it impacted how healthcare is delivered? And what does that future look like? Andy Carter is the CEO and president of the Hospital and Healthsystem Association of Pennsylvania, and he joins us tonight. Andy, welcome to the program. Thank you so much for being with us.
No, thanks for having me, Sam. Great to be here.
It's great to have you. And before we even get started, I imagine it has been a stressful, chaotic few months for everyone, more so for you and your team at HAP. So thank you for all that you guys do day in and day out to help deliver healthcare to patients across the state.
Well, thank you, Sam. As hard as we've worked, though, it doesn't hold a candle to the level of effort of our healthcare workers on the front lines. We're here to help them, provide support, guidance, and try to secure more resources for them. But I have to extend another word of thanks to our nurses, our physicians, and our hospital leaders who've really been on the front lines 24/7 for now, weeks after weeks after weeks.
Yeah, so well said. Our medical heroes for real. Andy, I want to start with, the term flattening the curve was kind of out there from day one. And everyone says flatten the curve. And the idea was to reduce the burden that our hospitals was faced with the influx of COVID-19 patients and the pandemic and so forth. Give them time to gear up, to get things in place. I want to ask you, I want to begin our conversation there. That impact that this virus has had on our healthcare system. We hear about the gearing up. We hear about needing to bring in more equipment and things like that. What has that impact been? What did hospitals need to do to prepare themselves for this pandemic?
Well, there are two major strategies that hospitals across Pennsylvania pursued. The first was to make space available for the expected surge of patients. And we're looking back in early March when projections suggested the possibility of a huge influx of COVID-19 patients. So job one was to make beds available, and that was only possible by suspending a lot of scheduled procedures and basically shutting down the great majority of healthcare. The second thing that hospitals had to do was to make sure they had all that equipment, personnel, and additional intensive care unit space to handle patients who would be expected to have profound respiratory treatment needs. So the combination of shutting down regular business and getting ready for a whole different kind of healthcare occupied a huge amount of time and effort, and ultimately combination of lost revenue and extra costs. So that has led to despite the fact that the surge did not materialize at the level projected, the financial hit to the healthcare system in Pennsylvania has been truly alarming and staggering over the last many weeks.
Sure, and I actually want to ask you about some of the specific numbers. In 2019, so pre-COVID-19, 34% of hospitals in Pennsylvania operate in the red, and another 29% reported operating margins between 0 and 4%. This is before the pandemic. What kind of challenges do our hospitals face day in and day out before the stress of the pandemic is added to that?
Yeah, even before we came into the pandemic, as you note, many hospitals, a solid third, of course, losing money, and then a bunch more, nearly another third who have razor thin margins. And that's all because we're all working very hard to to provide top quality health care while we're also have been working hard to pay as little as possible for it.
Hmm.
So that drive towards lower cost has put tremendous strain on hospitals. The second strain that we were experiencing was a sudden resurgence in growth of people without insurance. You know, the Affordable Care Act had taken us a long way to improving rates of insurance. But in the last year, there was an uptick in people without insurance. So that means we were providing much more uncompensated care as we came into 2020. So when you start with that lack of financial strength, hitting something this big puts a lot of hospitals at profound risk of either having to close or, as we've already seen, lay off highly valued workers. But there have been no choice in different parts of Pennsylvania, including the Lehigh Valley, including Southwest Pennsylvania, including Southeast Pennsylvania, statewide, thousands of layoffs.
And toward the end, I mean, this year, your organization is projecting a $10.2 billion shortfall in light of now the COVID-19 pandemic. So this is on top of the regular challenges that you just mentioned. So I want to talk particulars there for a moment. You've mentioned the layoffs. What happens if that shortfall can't get made up?
Well, I think hospital leaders are going to have to take a hard look at their plans for ensuring that they remain financially solvent and viable, and there to serve 12.8 million Pennsylvanians. They want to get out of this financially solid. And the fact is, though, that if there's no additional help, some of them are going to be more layoffs, some of them may face closure, and this is even after accounting for the fact that the federal government has taken significant action to provide financial relief to hospitals across the nation. That $10.2 billion figure doesn't take that into account. But when we do, we still have a $7 billion gap that they will be struggling to manage. So we've been asking the Commonwealth to entertain using some of its federal funding to help take some of the edge off that remaining billions of dollars of losses.
Sure. And I want to put that in perspective with, so our viewers who are watching this realize that this is not just a state kind of impact, but this is going to impact every community and their neighbors and themselves. If a hospital shutters, in the Lehigh Valley region where we're based, we have Lehigh Valley Health Network, we have St. Luke's, there's healthy competition, and generally if you need healthcare, you can get it. But that's not always the case across the state. In the more rural areas, if a hospital shutters, doesn't that often take away the only avenue for healthcare for some of our citizens?
It can add huge travel times to get access to even basic healthcare. And that's why, Pennsylvania is a state with a significant rural population. We can't turn our backs on rural Pennsylvanians. Right. And the financial stress experienced by smaller rural hospitals is truly extraordinary. And that's why we have to ensure that as a priority, we pay attention to their ability to continue providing essential healthcare services. And they're also the significant employer in their community. So their failure would lead not only to the loss of critical healthcare, but it would lead to hundreds and hundreds of jobs being lost in communities that cannot afford that kind of additional economic hit.
And with those job losses, I imagine it's not just a loss of income, but they're also losing their health insurance then.
That's another source of stress on family budgets. You lose your job, you lose health insurance, you either have to buy it out on the marketplace or you go without insurance. And that's why we're very worried about Pennsylvanians losing their access to both insurance and healthcare. So it's one of the most terrifying times that I've seen in a 40-year career in healthcare. Terrifying for patients who worry about their risk of infection if they go to healthcare. Terror for healthcare workers themselves, anxious about their jobs and their own safety. And certainly terror for communities worried about losing their valued healthcare providers.
Andy, let me ask you this. I mean, obviously, we know the COVID-19, the treatment process and the kind of focus on it has taken its toll. What have some of the things, what's been the reason for that? I mean, hospitals face different challenges day in and day out. Is this because of an increase of they need to purchase ventilators and purchase supplies? Is it due to the fact that a lot of our patients are Medicare based? And what's been kind of the driving factor that's really pushed COVID-19 as a big economic impact on our hospitals?
Well, I think the main reason is what we talked about at the outset, which is our effort in cooperating with public health authorities to suspend all these scheduled procedures, things like gallbladder removals or hernia repairs or kidney stone treatments, heart catheterizations. These are all very important medically necessary healthcare services that we suspended. And they provide a great deal of financial support to hospitals that they in turn use to help finance areas that lose money, such as the emergency department and the outreach to communities to help provide healthcare to people who otherwise wouldn't have access to healthcare. So that's a part of it, ending all that source of revenue. The other part is when we are taking care of COVID patients, their needs are quite extraordinary. If they're sick enough to require inpatient hospitalization, they can be there for 10, 12, 14 days, or for the most seriously ill, well over a month. And the level of care they need is extraordinary, especially if they need ventilator support to help them breathe. So that's another source of a real strain on hospital operations. And it makes the work of our healthcare workers quite a bit harder because they have to take extremely careful steps to make sure that they are protected against getting infected, wearing the right equipment, putting it on and taking it off safely according to very rigorous procedures. It adds a lot of complexity to healthcare.
Yeah, and as you said at the onset, are true medical heroes. Andy, I appreciate you kind of laying out some of these challenges. Don't go away. When we come back, we want to talk about where our hospitals can go from here and what that future looks like. So don't go away. We'll be right back. Welcome back to Face the Issues. Andy, thank you again for taking the time to be here. I want to pick up right where we left off. You were talking about one of the big challenges that COVID-19, the pandemic, has posed to our hospitals is the suspension of some of these scheduled procedures, things that are not COVID related. They're necessary, but in the moment when we're focused on the pandemic, we've kind of moved them to the side. Some of the hospitals throughout our Commonwealth, UPMC, LVHN, they're starting to ramp up now and starting to reopen for some of these procedures. As they do, I want to ask you about that process as they do that. They're not returning to full capacity yet, correct?
Well, that's correct for two reasons. First, they don't want to start treating patients until they're ready, but they have all the procedures in place to ensure that non-COVID-19 patients can arrive at the facility and feel confident and safe that they are at no risk of infection. So getting ready means that some of them are still taking time to put all those steps in place. The second reason it's ramping up very, very slowly is that patients, despite knowing they need medical care, remain anxious and worried. And that's appropriate. It's been a very challenging time for everyone. The science of COVID-19 is still evolving. Our understanding of how it transmits is still evolving. So people are showing degrees of reluctance to come forward and get back into healthcare. And so we have work to do to provide information to patients, to show them, to demonstrate all the steps we're taking to protect them. For example, scheduling appointments, spreading them out so that you're not in a crowded waiting room anymore. Those days of crowded waiting rooms are over. And so that's one example. Having enough protective equipment for both workers and patients who arrive, that has to be in place. So those factors add up to making the ramp up to what we used to experience a pretty slow process. So we've got months to go before we get back to anything close to what we were doing in February and before.
And let me ask you about that process then. Obviously these hospitals have been COVID focused since February, March. And so it's been 3 months that we're going on right now. And they're not going to be at full capacity this week, next week, and the next few months. You said it's a slow process. There's a $10.2 billion shortfall. You said it's probably closer to about 7 right now with some of the aid. That's still a bit of ways to go. Look at the timeline. What's the timeline for hospitals to get that funding, the support that they need before there are going to be drastic consequences?
Well, we've asked the governor and the General Assembly to move as swiftly as possible. Certainly, they should take action during June before we believe they recess for the summer, and then into the fall when they are likely not to be back in town. So we're urging action in June. We think it's important to provide additional resources. Otherwise, hospitals have no choice but to make tough decisions. So we're really hopeful that policymakers across Pennsylvania understand it. We've been working very hard to supply them with data that they requested so that they could assess the level of need that our hospitals face. And I want to emphasize that even large organizations that on paper seem to be flush with resources, they actually have a lot of obligations that offset many of those available resources. So we have to take account of that. We also want to make sure that the plans that our hospitals have laid to continue growing as increasingly effective providers of healthcare in all new settings, taking healthcare to people in their communities, that all costs money. We don't want to put those plans on ice. We also need resources to continue such strategies that have been very successful during COVID-19, such as telehealth. I mean, we are seeing more patients through telehealth technology in the last several weeks than we've likely seen over the previous year. This technology is proving to be highly effective. Patients like it. Providers appreciate the opportunity to examine patients using telehealth technology. We don't want to delay continued growth of that technology. So we need the resources to keep those in place.
Yeah, and I can't tell you how helpful and beneficial that is. As you know, I had COVID myself, and being in isolation, getting to do televisits is such a godsend, and to kind of move with that technology. Andy, let me ask you about those kind of innovative moves. We're seeing some innovation being done within our hospitals toward this end. Potentially, they're saving costs. Potentially, it's providing better healthcare. I know UPMC has started to do 3D printing with some of their test swabs and things like that. How much do you see innovation playing a role? Obviously, the funding needs to come. I mean, the biggest hurdle is the financing. Funding needs to come. How much do you see innovation playing in the ability to bring costs down and continuously provide good healthcare?
Hospitals have no choice but to pursue innovative strategies that will allow them to operate under even tighter fiscal constraints. Now, organizations like UPMC have the research capacity to develop entirely new therapies that will be hugely important to being effective healthcare providers for all hospitals and physicians and nurses. That's on one end of the spectrum. But even community hospitals will be innovating in how they find ways to provide healthcare as efficiently as possible, how they deploy nurses, respiratory therapists, and other practitioners very efficiently to be there at the patient's bedside, not too early and not too late. They'll be innovating on ways that they will reach out to patients in their communities, not just with telehealth, but by deploying community health workers, for example, and supporting efforts to help patients follow up on their care plans. That can be greatly important in accelerating someone's recovery if they follow doctor's orders with the support of a community health worker, for example.
And toward that end as well, I mean, we talked about the community health workers and the idea of the community in general. I mean, this impacts all of us. Are there partnerships? I know some hospitals are partnering with local chambers of commerce or business leaders, or I mean, perhaps like legal companies or whatever it might be. Are there partnerships that you see as beneficial to helping hospitals with whether it's with continuously providing good healthcare, spreading the word, or even with some of their funding challenges?
There's several ways. Nothing like a crisis to make one go out there and try to make new friends. And that's definitely been happening during COVID-19. For example, we did reach out to the business community and the state chamber to connect manufacturers to healthcare providers to help expand the supply of available protective equipment, as one example. But we also want to work with the manufacturing and business community around helping them develop new skills to help keep their workers safe in an era that will likely last for a very long time when we face the exposure to infectious disease. Mm-hmm. Businesses are demonstrating an interest in figuring out how to protect their workers in retail establishments and in their offices. And in hospitals and in the physician and nursing communities, you have people that are really good at this and can help businesses take steps to make sure their workers are safe. That's another example of collaboration and new partnerships.
And that's exciting to hear, the idea that we've said it throughout COVID-19. It's like a battle cry, right? We're all in this together. And the idea that we're in this together, not just with regards to the lockdown, but with regards to coming back and reopening and making sure our healthcare continuously gets delivered and gets delivered well. Andy, I want to close out this section with one last question. We started off talking about a lot of our hospitals ramping up, looking ahead at that, and you said it's a gradual process. How long do you see this taking? Because to be honest, if our ramp up is slow, we're going to slow the bleeding with some of these scheduled procedures now happening, but it's still not full capacity of what hospitals need to be doing in order to be able to maintain their costs. How long do you see this process taking, and what can patients expect for their return to the hospitals?
Well, two things. I would say the ramp up will take many months. Some of our hospitals project that they will achieve only 80% of their pre-COVID capacity by the end of the year at best. Others will not get even that far. So we have to expect a fairly long slog ahead of us. That said, we do want patients who have been very willing to delay their health care. It's time for them to come get health care because people are deferring medically necessary care. And let me give you a quick example that tells the story of the damage that happens when you put off health care too long. One hospital CEO in the middle of the state told me that their hospital in the previous 60 days had treated in their emergency department more burst appendices and more burst bowels in that 60 days than the hospital had seen in the previous decade. And wow. That meant people who were suffering modest pains, who normally would go to a hospital to find out what was going on, deferred it and delayed it until it was too late and they needed emergency care. That's happening hundreds of times, if not thousands of times across the Commonwealth. So people are going to have to come in for health care to guard against an even worse health outcome. So that's going to be a very important body of work for hospitals to be communicating to patients and communities that the time to defer their health care is over. They should come in. We will keep them safe, even though I should note, most experts are predicting some resurgence of COVID-19 in the fall. So we're going to have to, walk and chew gum at the same time, take care of these patients that have deferred care, but also be ready for some amount of additional COVID-19 patients.
Great. And I want to ask you about that, but we're going to go to break first. And when we come back, we'll go right there. Andy, thank you again. Don't go away. We'll be right back. Welcome back. Andy, thank you again for your time, your expertise, and your insights. I want to close out by just giving you the floor. You started this conversation talking about this at the end of our last segment. there are a lot of patients and a lot of our viewers watching this who have been putting off getting healthcare. And I know some of the numbers that we see a drop in heart attacks or strokes. And the reality is the disease hasn't changed. People are just not going into hospitals anymore. And a lot of that's driven by concern of the virus and concern, as you mentioned, of a potential second wave. What would you say to patients who are concerned about getting healthcare, are concerned about the second wave? What is your message to them?
Well, first thing I want to do is thank them for their patience and their cooperation with public health authorities and the healthcare community. But they've paid a debt now. Now it's time for them to come get the healthcare they need. And it's time for lawmakers to help make sure that the healthcare delivery system remains as strong as it is today for weeks, months, and years to come. We owe that to Pennsylvanians. So we have to get to work so that they can come back and get the healthcare they need. Really, healthcare heroes on the front lines, we owe them a debt of gratitude, but we owe all Pennsylvanians a huge debt of gratitude for their willingness to help flatten the curve. But now they need healthcare, so let's get going.
That's a great word. Thank you, Andy, for that and for your time. And to your point, healthcare doesn't just impact our individual wellness, it impacts our community, it impacts the economy, it impacts all of us across the Commonwealth. And so we are grateful for the work you do and for all of our medical heroes across the state, and we continue to hold them in our prayers as well. So, Andy, thank you again for taking the time. That is all the time that we have tonight. I want to thank Andy Carter from the Hospital and Health System Association of Pennsylvania for being with us. Continue this conversation with us online. Just remember to use the hashtag #FaceTheIssues. My name is Sam Chen on behalf of all of us here at Face the Issues. Thank you and good night.